look at drug administration. Drug administration, we have different objectives that we need to cover in relation to the administration of drugs. So the first thing that we need to know is to describe the 10 rights of medication administration, then to explain the importance of patient identification, verification, and documentation. And we also need to identify and address the common medication errors and risk factors that may occur during the process of drug administration. And the fourth objective is basically to explain the advantages and disadvantages of each route of drug administration. And finally, to calculate medication dosages accurately. So I want us to start with the first objective, and that is describing the 10 rights of medication administration. So the written orders in relation to medication is basically the medication orders that are documented by the physicians in order, in the order sheet in the patient's hospital chart. So when you're in the ward or when you're in OPD, whether in the dispensary, the patient is always given an order sheet or a drug order sheet, and this one is basically where they write the prescription of the drugs that the patient is supposed to get. So the physician will always see the patient, get the diagnosis and prescribe the treatment, and that one is called the order sheet or the physician's order sheet in the patient's hospital chart, and the treatment that is based on the diagnosis. The knowledge of medical terminology, abbreviations, and symbols that are used in prescriptions and orders is also crucial for us to know. So when the drugs are prescribed, we need to understand the different symbols or the abbreviations and then the terms that are used in relation to the medical or the administration of drugs. So when you do not know, then you end up messing up the way that you're going to administer the treatment or the medications to your client. So it is very important for every health worker to understand the different terminologies that we use in drug administration, or the regulations in the way that you're supposed to give these drugs, the frequencies and so forth, and also the symbols. So this is very crucial for us to understand as we give medication to our clients. So drug administration abbreviations are basically in this way. The IM, when you find that the order, the physician's drug order or the prescription is having some relation to IM, then you know it is intramuscular. So you have to give this drug intramuscular, whereby you just inject it deep into the muscles, and that's how it is supposed to be administered, and that's what it is meant by IM. Then IV is intravenous meaning through the vein, and you don't give drugs in the arteries, through the arteries, but you give drugs through the veins, and that's why they call intravenous. So when you give it to the arteries will always cause a backflow, and this drug may not actually be taken in the right way. So you're supposed to give it intravenously through the vein, and that's when this drug can be actually saturated. Then PO is a mouth or paos, meaning through the mouth. So this drug can be either liquid like syrups, it can be capsule, it can be a tablet, but is taken through the mouth. Then PR is rectal, that is per rectum. It is inserted into the rectum and it is being absorbed from the rectum, because we very well know even the rectum has the blood vessels, it is saturated with blood vessels, so those blood vessels from the rectum can help us in relation to the absorption of these medications. So we have to give these drugs in relation to how actually the physicians have prescribed the treatment. Then SC or SQ, that one is subcutaneous, and we all understand what subcutaneous is. When you look at the layers of the skin, then you can get to understand where is the subcutaneous tissue, and that's where you're supposed to inject the drug, and it can be in the angle of 45 degrees. Then sublingual, SL, that is under the tongue, And when you look at under the tongue, you realize there is also blood vessels running beneath the tongue, and when the drug is put under the tongue, it's always absorbed into the body through the blood vessels under the tongue. Then IED is intradermal. Intradermal is just beneath the skin, and that one also is one way of giving medications in relation to how they are absorbed in the bodies. So each drug is given in a different way in relation to how it can be absorbed easily into the body. Then IVI, that is intravenous infusion. We basically use fluids like normal saline, Ringer's lactate, and the rest. So if someone is supposed to get IV fluids, the prescriber or the physician may put IVI, meaning that you're supposed to pass this through the vein and the person will be able to receive the fluids. And we use this sometimes for rehydrating the patients, and sometimes we can use it also for introducing maybe glucose and so forth, depending on the prescription and the situation of the patient. Then PRN, as needed, that is pro renata, and it is basically meaning that at any time when it is necessary. So you give the patient when necessary. When you realize that the patient is having either pain, then you can give a painkiller. When there is no pain, you don't give. So this one is given whenever it is needed or whenever necessary. Then QD is once a day. So you give a patient treatment once a day. Sometimes they put OD, which is given once a day. If it is in the morning, you give only in the morning. If it is in the night, you give only in the night. So once a day, meaning giving that drug only one dose per 24 hours. Then BID, and that is twice daily. Twice daily, you give either in the morning, then after 12 hours, you again give. So sometimes people mistake that twice daily means maybe at 8 in the morning, then again you give late in the evening, but it's after every 12 hours. So when you give at 8 in the morning, you again count 12 hours, then you give the patient the next dose. That's what BID means, or twice daily. Then TID, sometimes some prescribers put TDS, which is 3 times daily. So when you give this 3 times daily, it is after every 8 hours. Some people mistake, or some physicians or either pharmacists or dispensers guide our patients. They tell the patient you're going to take it 3 times a day. The patient takes in the morning, takes in the afternoon, and takes in the night. But basically, thrice daily or 3 times daily, TID or TDS means taking it after every 8 hours. Then QID, QID is 4 times daily. The patient takes the drug after every 6 hours. So you have to give the patient these instructions in relation to hours, and they'll be able to take this drug according to recommended time or frequency. Then the verbal orders are similar to written orders, but conveyed verbally, whereby you just tell the patient what he's supposed to do. And when you're telling the patient, you're going to give all the instructions verbally. Then must include the same information as written orders, and should be recorded with the date. So you have to give these instructions to the patient, and the same instructions that you're giving verbally should also be reflecting in written. And these orders, or these verbal orders, should always be having the date. You have to write or to give the exact date when the verbal orders or verbal information was given to the patient. So verbal information should be related to the written orders, so that the patient can be able to understand what is actually expected to do as a patient in relation to his prescriptions. So explaining to the patient the order verbally should be following the written order. If it is saying twice a day, as I mentioned, twice a day means after every 12 hours. Then also verbally you should do the same, and also the date should be clear when you're giving these verbal orders. Then after recording, the orders must be repeated to the physician for verification. So you can also find out who is dispensing, or the health worker who is giving the treatment should verify this with the physician to confirm whether this is really the true orders of drugs or medication that he had written in relation to the written orders. Then documentation should include the physician's name, notation of it being a telephone order, and staff signature. So when you're writing this information that the physician has given you through verbal orders, you should always note them down, and you should also say that this was instructed by the physician on either phone call, and you put the name of the physician who instructed you to give that medication or those drugs. And above all, you should put your signature as a person who was given the instructions verbally by the physician. So the different types of medication orders can be start order, immediate administration, usually just once. So this can be mostly done when a patient is being referred, and you just say, I'm giving this treatment for a start, and the patient will continue it from another facility. So the start orders are just like treatments or medications that are given first dose or start, and it is not repeated anymore. So this can be done also if a patient is expected to continue with other drugs. Then there is another drug that they can give for a start, then others can come later as different medications. Or you're referring a patient, then you say that you just give this drug, so the patient can be referred, then the other medications will continue from wherever the patient will be referred. Then single order, one time. So the single order is just once, and this medication, this is just a medication to be given once at a specific time. So they give this treatment, if it is once, maybe at around morning hours, it is given once. If it is at night, it's given only at night. So that is a single order that is given at a specific time. Then standing order may have no termination date after carried out indefinitely. So there can be some medications or some medication orders that will be given to these patients, but they don't have a time of actually terminating the medication. They just continue giving them, but there is no specific time of you saying maybe this patient is getting this treatment for 5 days. Improves, or the patient doesn't respond to the treatment, and the medication can be changed. So we also look at the PRN order. This is needed order, and mentioned earlier on in our terminologies and abbreviations that PRN is whenever necessary or whenever needed. So it allows the nurse or respiratory therapist administration when necessary. So you only look at this drug when the patient gets a problem in relation to maybe the use of this drug. That's when you administer it. But when the patient does not need it, actually don't give it. That's why they say PRN, whenever necessary or when you need to administer this medication. So there can be also such kind of medication orders. Then the general rules in drug administration, follow the 10 rights, ensuring the right patient, the right drug, the right dose, the right time, route assessment, documentation, education for the patient, evaluation of your treatment and everything that you have done, and the patient's right to refuse. So you realize that you need to know the right patient, the right medication. Then you also need to get the right drug for the right patient, and the right dose of the drug to the right patient, and should be given at the right time. That's why you're supposed to document the time when we are giving these medications, the dose, the drug, and also the name of the patient should be reflected in the patient's drug order chart. Then the route is very important because there are some drugs that we are not supposed to give by intravenous, and when we give them, it can cause a lot of impact, especially to the heart. So we have to take note of the different routes that have been prescribed by our doctors or the physicians before we administer these drugs. Then assessment, you have to assess the situation of your patient in relation to the different routes or the different types of drugs and the dosage that you're going to give to your patient. So when you assess, you have to see, is this drug really for this patient? Am I giving this drug at the right time? If it is after every 8 hours, and maybe the first person gave in the morning, then you have to assess at what time, and now what is the time. Has it really made 8 hours since it was given the first dose? So all that you have to look at before you start administering your medication. Then documentation is very key because this can help the next health worker or the next nurse who is coming to take her from you, because you'll have to read the patient's chart, and that chart can direct him or her whether to continue with the medication or not. And also the prescription of the doctor can also vary depending on the assessment during the reviews, because if the patient has been admitted and they review him every day, it means maybe also the drugs may end up changing, or the dosage of the drugs may end up changing. Then education for the patient, we should also educate our patients. We should teach them about the drugs, especially those who take the oral drugs. We should teach them about the drugs, and those who take the subcutaneous or the intradermal, because sometimes they end up injecting themselves like the diabetes. So we have to educate them in relation to the drug administration. Then evaluation, we evaluate our patients in order to assess for any kind of adverse drug effects, and then the patient's right to refuse. They have a right to refuse, and when they refuse, we don't force them. We have to allow the patient's autonomy to be actually in play in relation to every kind of service that we give to them. Then the types of drug preparations, we have the solids, we have the semi-solids, and we have the liquids. So in relation to the solids, these are basically tablets, solid medication forms made by compressing powdered ingredients, usually swallowed whole. So you just swallow this, they are basically tablets. Then capsules are also solid medications, and it's formed consisting of a gelatin shell filled with powder. It can be a powder, it can be a liquid kind of ingredient that is mixed and is actually sealed in a kind of gelatin container. Then it is typically also swallowed as a whole. You don't open it. You don't open those shells, you just swallow it the way it is. Then the troches are solid medication forms that are designed to dissolve slowly in the mouth, often used for sore throats or delivering medication directly to the mouth or throat tissues. So this can also be used in patients who have maybe challenges or different kind of conditions with their mouth or in the throat. So they are given this and they can use it in the mouth. When it dissolves slowly, they keep swallowing it and can be able to cause an effect in the throat or in the mouth where there is a problem or where there is an infection. Then the semi-solids, these are like suppositories. They are also solid medication that is inserted rectally or vaginally for local or systemic effects. So we insert, it can be either paracetamol that can be applied rectally. It can be maybe some suppositories like the vaginal suppositories. These ones we treat either candida, and they are inserted into the vagina and is being absorbed and this causes an effect in the management of either candida and other vaginal kind of infections. Then the pests, these ones are thick, concentrated topical medication with high powder content for drying or protective effects. This can also be applied, especially topical infections. Then ointments, they are greasy, oil-based topical medication for long-lasting lubrication and moisture on the skin. So we give this on patients who have also skin conditions, just to apply on the surface of the skin. Then creams, somehow watery, and they are based also topical medications with the lighter consistency for easy application and absorption. So the creams are a bit lighter than the ointments and the pastes. The foams, these are air-filled topical medication for cooling, cleansing, or delivering medication to hard to reach areas. So this can also be used in order to apply, especially topically, to manage the different kind of conditions that affect either the skin and so forth. Then liquids, we have the lotions, we have the solutions, we have the liniments, and then the elixirs and the tinctures. So all these drugs are in form of liquids, and when they are used, they are basically used in different ways. So you can use them to manage different conditions. It can be on top of the skin where it is just applied, or it can be something that can be swallowed orally, like for example the elixirs. Those ones they are sweet, some of them are alcoholic, and they are used orally. And then others can be like the liniments. These ones are just applied topically. So liquids can also play a role, basing on where the infection is and why it is supposed to be used and its effect on these different kind of infections. Extracts, aromatic waters, and the syrups. These ones are also used in relation to different infections. When you look at the extracts, these ones are concentrated forms of plant or animal material that is obtained through various methods. So they are extracted either from the plants, they are extracted maybe from the animal materials, and this can be used in different conditions depending on what kind of extract and what kind of ingredients are used for making the different extracts. So the syrups also play a big role in relation to the oral treatment, especially for children, and for it is a bit thick or viscous kind of liquids, and these ones contain especially sugar, because children are the ones who are more given these syrups. Then suspensions are also in relation to syrups because they mix it. It comes in a solid form, but they mix it with some fluid or some water. It is diluted in order to make a suspension. Then oils and emulsions, these ones are mixtures of oil and water, and it is stabilized by an emulsifier that is used for topical application or as flavoring agents. So this one also has its own function depending on what effect it can cause on the infection that they are trying to manage. So these ones are all in form of liquids. When you look at the routes of drug administration, you realize that there are various routes for administering drugs, whereby the patient's characteristics and needs determine the kind of appropriate route that can be used for administering the treatment to these patients. So broadly, it is divided into three categories, and one of them is the enteral, then you have the local, and you have the parenteral. So the enteral route is most popular and is established method of drug administration, and its advantages are it's the safest, it's much more convenient, and also it is economical, and it is non-invasive, can be self-administered. So the patient can even administer to himself. It does not need a lot of skills and either technology in administering it. For the disadvantage, it is irregular. It has an irregular absorption rate and is fast pass metabolism. So it has to be metabolized before it is being absorbed into the body, because this is more of swallowing. Entero means it goes into the digestive system. So it has a slower onset and is unsuitable for unconscious patients. You realize that the patients who are unconscious cannot swallow drugs orally. Instead, they can choke or they can get aspirations. For parenteral routes are better than maybe enteral, depending on the state of the patient. So it includes injections, inhalations, transdermal, and then transmucosal routes. So these are different routes can be used for the parenteral administration of drugs. Advantages and disadvantages of each of these is basically for the injection, the intradermal, subcutaneous, and then intramuscular and intravenous injections. So the advantage is that it can be used in patients who are unconscious, and it is also fast acting in case you want to use them, especially the intravenous and the intramuscular, even subcutaneous, because we said it's basically absorbed through the blood vessels or through the mucous membranes, where it is placed like under the tongue, the rectum, the vagina, and so forth. Those areas are vascularized. They have a lot of blood vessels that can help in the absorption of these drugs, and they can be able to cause an effect, and it may be an immediate effect. Then intradermal injection site, just beneath the top layer of the skin around the dermis. So when you look at the anatomy of the skin, you'll be able to identify the location of the dermis, and just around beneath it is where they give the injection. So the advantages of this parenteral route is that slow, sustained release of medication, and that is basically for the intradermal, though it is a parenteral route, but intradermal, it is it includes the injections and so forth. So when you look at the intradermal, it's a slow, sustained release of medication. It takes some time for it to be absorbed. Then it is basically a small volume injection that is required, and it is good for allergy testing and some vaccinations. They basically also use intradermal kind of route. But the disadvantages of intradermal is that it requires precise technique for you to really get around the beneath the dermis. Otherwise, you may go beyond it. Then painful due to a rich nerve supply in the skin. So you realize the nerves are much more around the dermis, on top of the skin, within the dermis, and that's where you can feel a lot of pain, because the nerves always communicate, and are the ones that can make you actually feel the pain. So these nerves, when they are pricked, you feel a lot of pain within the dermis. Then there is limited volume capacity. So when you look at all these disadvantages, you may realize that sometimes these drugs, even if it is parenteral, it depends on how it is being administered. Then so its subcutaneous injection site is basically the fatty tissue layer beneath the skin. But the advantages is that it is easier to administer than the intradermal injections. Then it's slower and steadier absorption than the IM injections, and it is larger volume capacity than the intradermal injections. So this is a comparison between the intramuscular, intradermal, and the subcutaneous. Then it is also used for various medications and vaccines. So most of the medications and the vaccines are always administered subcutaneously. But the disadvantage is that it is slower in absorption than the intramuscular injection. So the intramuscular injection can be absorbed much more faster compared to the subcutaneous. Then also it has a potential for tissue irritation with some medications. So it can cause a tissue irritation, whereby some people end up having either abscess in their skin or in the tissues, which can actually cause more problems, like maybe I can give an example of abscess and so forth because of intramuscular injections. The other one is intravenous. For intravenous, this is directly into the vein, as Alaron mentioned, and the advantages is that it's much more faster than the rest of the routes. I mean the different types of mentioned, the intradermal, the subcutaneous, and the intramuscular. This one goes direct into the vein, and that's why it is much more faster in delivering the medication. And the precise control overdose, you can also try to control the overdose. Then it's used for emergencies, fluids, and medications needing immediate action. So when you need to actually handle an emergency, then intravenous route of drug administration is preferably better than the rest. But also it has its own disadvantages in relation to how we give our patients and also the action of these drugs. So it requires a trained healthcare provider or professional, because if the provider or the healthcare professional is not able to get into the vein, able to introduce the cannula through the vein, then you may not be able to administer the intravenous medications. Then increased risk of infection and complications can also occur, whereby these patients can have high risk of infection, because you may introduce infections through the vein to our patients. And when the infections get direct into the vein, this will contribute more of sepsis to our patients, which cannot be managed, and this will cause us more issues than even the diseases or the infections that we have been trying to manage. So we have to look into this, and aseptic techniques need to be managed very well, so that we can avoid introducing infections to our patients and also further complications. And it is not suitable for all medications. I remember I said in the beginning that not all routes the same, or not all routes can be suitable for the administration of every drug. So we have to consider which drug can be given intravenously and which drugs cannot be given intravenously, because there are those drugs that can go direct and affect the heart. So when you give them intravenously, they may end up actually causing more harm than good to our patients. Then inhalation, administration of volatile liquids and gases can be through inhalation. Then the advantages include rapid absorption and avoidance of hepatic fast pass metabolism. So when you give these inhalation drugs, the inhalers, they always bypass the metabolic pathway, whereby it goes direct to act either in the lungs, where maybe there is a problem in relation to respiration and so forth. Then the disadvantages are irritation by irritant gases. In case these are gases, some of them may irritate our patients and contribute to difficulties altogether. Then transdermal route. For the transdermal route, this is the application of highly lipid soluble drugs over the skin. And the advantages is prolonged duration of action, constant plasma drug levels is also an advantage. And then also the types can be inaction, eutrophoresis, and then the jet injection. All this can be given through transdermal route. Then transmucosal route can be absorption across the mucous membranes. So you just put the drug around the mucous membranes, and it is being absorbed into the body through the blood vessels that can be around the mucous membranes. Then also it includes the sublingual, the nasal, and rectal routes. As earlier mentioned, that the routes can be the rectal can be whereby we put the drugs around the rectum and it is being absorbed by the blood vessels and the mucous membranes around the rectum. So the absorption across the mucous membranes can be through sublingual and the tongue, can be through the nostril, especially those who bleed through the nose, and also the rectal routes that can be through the transmucosal way of drug administration. Root of this, you realize that some of them are of advantage to others, and yet others may not be of advantage. So when you use some drugs in a way that you are supposed to you're not supposed to give, like the sublingual, there are some drugs that are advisable that when you give them through sublingual, they may cause a much more severe effect than you expect. For example, nifedipine. Nowadays, nifedipine is not actually allowed to be given sublingually because it drops the BPs suddenly and cause a negative impact to the patient. So when you're administering these drugs, you have to look at what impact can it cause in case I use this route. Systems of measurement, 3 measurement systems are used in medication administration. The metric system, and this one is a measurement system that is based on units of time, commonly used in pharmaceutical settings. So they are mostly used in the pharmaceutical settings, not everywhere. Then apothecary system is an older system originating from England, based on the weight of the single grain of wheat, with the grain being the basic unit of weight. So in most cases, even our patients, we measure them and then we use their weights for calculating the amount of drugs or the dose of the drug that we can give them. So using the patient's weight to measure the amount of maybe the milligrams, the international units that we are giving the patient is very key, because we may end up overdosing if we don't weigh them, or underdosing. Then household measurement, it uses everyday items like teaspoons, tablespoons, ounces and pounds for weight, and also pints, quarts and gallons for volume. So we basically use maybe 2 teaspoons, tablespoons, and so forth. Look at the syrups that we give to our patients. We may use the household measurements, whereby you can say a spoon can take about 5 meals, and the child is supposed to be given maybe a syrup of cough, ampicillin or amoxicillin, 5 meals after every either 6 or 8 hours. So we can use the household measurement. And now on the dosage calculation, if you're going to calculate your dose for the drug that you're going to give to your patient, you have to look at the amount that is desired, how much do you need, and that is what you're going to calculate for. Then down the amount of the hand on hand, what you are having at the moment, then times the quantity that you require. And now you're looking for Y, which is the tablets that are required. So the amount desired is the D, which is the dose that you need to calculate. Then now the amount at hand, what you have at that time, times the quantity. Then you'll get the tablets that you need for your patient, depending on the different drugs that you have, the different amount, or the milligrams, or the kind of international units, and the meals. So you calculate in relation to how your drug is measured. Is it measured in milligrams? Is it measured in meals? Is it measured? What kind of measurement is used? And that's how you're going to calculate the dosage for your patient. And I remember saying up here in this slide that we can use the household measurements in relation to spoon after you've calculated your drug. Then you can see if it is 5 meals that the patient is supposed to take. Is there anything that can help you get the 5 meals? Then you use it for measuring to the dosage or the amount of the meals that you expect to give to your patient. So drug administration is basically something that is very important for everyone to know. If you fail to understand about drug administration, then you'll fail also to manage your patient. So we have the general rules in administration of medications, consulting with the superiors for unclear orders. You may find that the physician has written an order, but you have failed to understand the prescription. Please consult. So it is very necessary that as health workers we need to consult each other. Where you're not understanding, inquire for clarity. Then maintaining cleanliness, environment has to be clean, and everything that you're using for administering the treatment has to be clean in order to prevent actually a transmission of infection through the way that you're going to use to administer your drugs. Look at the side the route of intravenous. You're going to introduce microorganisms into the circulatory system, and the patient will get more infections compared to when he came to your hospital. Then avoiding contamination of either the drug. When you're diluting, how are you diluting your drug? When you're withdrawing, how is your syringe? How are you holding the ampule or the vial? All that is very important, and that's why we wash our hands before we start any procedure. Then ensuring patient safety is very key. Make sure that they know the name of the patient, you know the amount of the drug for the patient, and you know the dosage, and you have all the documents in relation to the prescription. And when you're administering, you have to make sure that your patient is safe from any danger in relation to drug administration. Proper documentation is key, and you must document everything in relation to the dose, the type of the drug or the name of the drug. You have to talk about the site. You have to mention also the time, and you put your signature as the nurse who has administered the medication. So the principles applied in pharmacology, it uses the acronym CHECK to outline the principles for pharmacology. So C is check why the medication is given and know its classification. So you have to know why is this drug given and which class is this drug, so that you can be able to understand the reason why your drug is given and what kind of drug are you giving to your patient. H is to determine how to monitor the medication's effectiveness. How are you going to see that this drug has worked for your patient? Then you should be seeing maybe some improvement, some signs and symptoms that the patient was presenting in relation to the condition disappearing or they are clearing. Then you can be able to see that my drug is effective. Then E is to establish the correct timing for medication administration. So you need to know the correct time when you have administered your drug, and when you're documenting, you have to put the right time, exactly when you gave the medication, and also you need to advise the patient on the next dose when is to get another treatment, depending on the physician's drug order in relation to the time and the dosage. Then provide client teaching regarding therapeutic and side effects. You need really to tell these clients some of these side effects. You have to tell them how this drug works. You have to tell them on the adherence and so forth. So everything in relation to the therapy or the drug that you're giving the patient or the administration should be told to the patient, so that even when they see some of these side effects, they just know it's from the drug. Then also K, identify the interventions to counteract adverse effects safely. So you should be able to know, in case this patient gets an adverse effect, what am I going to do in order to help this patient come out of this challenge or this problem. So you should be able to know that in case this patient happens to show this kind of side effects, or this kind of side effects are minimal, but adverse effects can even make your patient to die. So how are you going to respond? What are you going to do in order to counteract these adverse effects, in order to save the life of your patient? So all those interventions you should be knowing. Then medication errors, many times one say that people get into these errors. Someone knows that she has given a wrong drug, she has given through a wrong route, maybe she has given an overdose. but people keep quiet. But it's very important for us to always report or mention in case there is any medication errors. So medication errors are a significant concern in healthcare. We are really so much concerned as health workers because your patient came as a someone who has come to seek for a service. Then you end up actually causing these errors which may cost the life of your patient. So it's very important for us to know that it's not good, and it's not fair enough for you to keep quiet if you've made an error. So approximately 1 in 10 patients experience harm due to medication errors. So some of our clients get these experiences, but we always keep quiet and we don't report. Then despite being preventable, medication errors continue to occur. We can prevent them, but people have failed to be keen enough, maybe due to workload and so forth. So we have we have failed to prevent actually these errors. So this presentation will discuss the causes of medication errors and interventions to prevent them. So we need to know what are the causes of medication errors and what are the interventions to help us prevent them. We have our facilities, we have our health centers where we are working, our hospitals. We can reflect back and see what are the causes of these medication errors. When we are in the facility, what happens and end up causing medication errors, and what can we do? So these complications, these causes can help us even to identify the interventions in relation to the causes. So each one of us should be having an idea on what could happen in our facilities that can lead us to have these medication errors, and also try to figure out how can we intervene in order to prevent these medication errors. So the causes of medication errors are physician negligence. Doctors may fail to rectify prescription mistakes, relying on the pharmacist. So they may also be reluctant to amend prescriptions from other doctors. So when someone prescribes, sometimes I can give an example of having seen one of the doctors sometime who wrote a prescription, but he had put an overdose. But when I looked at the person, I realized the doctor was either tired or he did not understand the actual amount of the milligrams per tablet. So we need to help each other. So in that way, when you tell them, they can be able to remember, oh, so it was supposed to be like this, and you'll be able to correct. Otherwise, we shall end up actually we are giving medications to our patients, and yet we are overdosing them, and they end up with adverse effects. Then workload, as I mentioned, workload and stress. Healthcare workers, especially nurses, may experience excessive workload and stress, leading to errors. You find one nurse in a unit and she's the only one handling a very big ward, and when she continues giving treatment, she has not eaten, she's hungry at the same time, and this can cause errors in drug medication. Then also lack of training. Employees may also lack adequate training and education on medication administration. So sometimes our different institutions, we don't encourage our patients to always have skills hands-on, and they end up actually not doing the right things. So we need to make sure that we encourage our students as we are training them to always work, to always put hands on, so that they can get the skills. And when you do something by yourself, you can be able to remember and can be able to understand. But when you don't do something by yourself, you always not understand, and you end up making errors. So employees may also lack adequate training and education in medication administration, and they end up giving drugs wrongly. The drug that is not given IV, they end up giving the patient IVs, and the patient reacts. So these are some of the causes of medication errors. And then communication issues. poorly written or incomplete prescriptions contribute to medication errors. So we need to complete our prescriptions, and we also need to communicate verbally when someone has come to take up maybe the word from us for any duty. You've been maybe for day duty, someone has come for evening or for night. We have to communicate to each other. We have to tell them the verbal report, then we have the written reports, so that we can reduce these medication errors. And our prescriptions should be complete, and they should be clear, that they should be readable, so that one should not mistake maybe OD to be QID. So this is very important. Then interference and distractions, interruptions during the medication administration process can lead to errors. Someone can withdraw maybe the clofenac, and from nowhere she's interfered and she just puts it on the trolley. By the time she comes back, she picks and she thinks that is maybe penicillin. She ends up injecting IV, and it is the clofenac, and the clofenac is never given IV. So I realized that due to the distraction or interference of this person in the middle of drug administration procedure, she ends up causing errors to our patients. Then lack of focus due to competing tasks and responsibilities. We have a lot of things that we always run around with. We might be having other challenges somewhere. We might be having other activities somewhere at the same time you're supposed to be on duty. So you realize that there are so many competing tasks and responsibilities in this one nurse, and she has to try to cope up with all of them, and in this way she ends up causing medication errors. So what could be the solutions for decreasing these medication errors? Having mentioned the different causes, and now we are looking at the solutions. I believe through those different causes we can be able to generate the solutions. So employee education and protocol implementation is very key to enlighten the employees about medication errors and instruct them on necessary changes. Then also encourage open discussion about errors and ways to prevent future mistakes. So there should be like CMEs where these employees can interact with each other, and they are able to discuss and storm on how they can prevent this kind of mistakes. Then implement new protocols or action steps to prevent recurring errors. So you should be able to give these protocols. Our ministries of health in different countries, in different places, like even our managers in their different facilities, can be able to develop these protocols and implement them to help us prevent the recurring errors. Then also encourage open communication. Let people be able to communicate when they get these challenges or when they end up causing medication errors, so that this can be arrested before the patient gets into a serious complication. Encourage employees to speak up about potential patient harm. That is actually what I've already mentioned, that they should always be able to speak before the patient gets into a problem, in case they have done any medication error, maybe a wrong route or overdosage of the patients. Then foster an environment where staff feel comfortable reporting errors, because if in the facility there's a lot of toughness, everybody is rude, actually the nurses, the health workers will not feel comfortable to speak out whatever is happening. So they should be always given that platform and that freedom for them to speak out in case there is any problem in relation to either medication errors or any other issue, not only medication errors. Then empower all health workers to address mistakes regardless of their positions. Sometimes people think when they are in a lower cadre, they don't have the capacity to help in addressing some of these issues. But when you, the employer, or you, the leader, shows them that it's very important, and it is the role of each and every health worker to help address these issues, you realize that we would even reduce them, because everyone would be participating and would be understanding what these errors are. Then utilizing technology, implement point of care systems with barcode scanning for medication administration. Then also barcode scanning reduces errors related to poorly written or incomplete prescriptions, as we already mentioned. Then technology ensures also accurate labeling and identification of medications, reducing the risk of errors. So we need to see that these drugs are actually labeled very accurately, that you can easily identify them. But the challenge is most of the health workers not want to read. You just look at the bottle and it resembles like X-Pen, and it is actually ampicillin or it is some other drug. Then you get and you inject the patient thinking it is ampicillin. So it's better that you read. The labeling alone may not help, but we need to read what is labeled and what is written on the bottles. And then medication reconciliation, implement medication reconciliation processes to manage patient medications during transitions of care. So you should always make sure that you document. You should make sure that the patient's drugs are always in place, so that you can be able to transition from one duty to another, or from one health worker to another, and to avoid these medication errors. Ensure communication and collaboration between healthcare facilities to prevent medication discrepancies. So this is key, whereby there is good communication and collaboration in these facilities. They are able to prevent any kind of differences in relation to the drugs that they administer to their patients, especially in the dosing and so forth. Then also assign the professionals or systems to facilitate medication reconciliation processes. So there should be people who should be responsible to play this role, so that it can be able to be rectified. But when there is nobody assigned, there is no one who will take lead, and nothing will be solved. Compliance with 6 rights, emphasize compliance with the 6 rights of medication administration. When you follow these 6 rights, you'll be able to reduce or minimize some of these medication errors. So this is very key for us to follow as health workers in relation to drug administration. Then verify the right patient, medication, dose, time, route, and documentation. And this I clearly explained in the first slides. And we are also supposed to implement double checking procedures by a second healthcare worker to validate medication administration. We should always be able to check. And I mentioned that let's not look at the colors of the bottles, let's not look at the colors of the tablets, but let's be able to read and understand, or get to know what drug is that, other than us looking at the colors of the bottles and also maybe the boxes depending on the package of the drug. And this can mislead us to use a different drug which is not actually the one that is being prescribed. Then barriers to medication error reporting, a fear of administrators, and repercussions may also deter nurses from reporting errors. So they can end up fearing, like if I mention that maybe I gave this dose, how will they say about me? So we should always tell them that they should stop fearing, they should always speak out. Healthcare workers may also selectively report errors based on the perceived severity. When people see that they have given a drug that can cause a lot of harm to the patient, they may fear to actually report about it. But in case they see something that is minor and it does not cause any harm to the patient, then they may end up reporting that one and leaving the most serious kind of error. Then also we have to encourage the culture of reporting errors to facilitate learning and prevent future occurrences. So this is key to this point. And basically this comes the end of our session in relation to drug administration. So I encourage all of us to look at the rights and be able to follow those rights. And also we need to understand the different causes of medication errors and be able to look out for solutions. I know we have different kind of challenges or different kind of causes of medication errors in a different facility, depending on the setting of the facility, depending on the number of patients we get and also the number of the staffing. So when we know the different causes of medication errors in our facilities, then we can be able to locally manage them using our few or little available resources in our facilities, and this can help us reduce some of these medication errors, and this can help us also manage our patients well. And for that case, I want to encourage all of us to understand our drug administration so that we can be able to meet the needs of our clients. I appreciate all of you, and I want to say a good night for now. Meet you again.